So I want to talk about how to use a pelvic wand. So here we have the Intimate Rose pelvic wand, which is a really great product that we're recommending to our patients. We have a thicker side that kind of comes to a little point here, which is really great for trigger point release and decreasing tension and tone in a muscle. And then we have like a longer, skinnier side. This can be used for vaginal work or rectal work, whereas this side is generally recommended for vaginal work. At first, I like to orient ourselves to anatomy because it's really helpful to know what structures are we actually working on or around. So when we think of the pelvic floor, we think of a clock. And so we have our pelvis here, and the way in which we would orient ourselves is like this here. So at 12 o'clock, we have our pubic bone and we have our urethra. At 6 o'clock, we have our tailbone. And then there's specific points all around the clock where some of these muscles are attaching to. So again, 12 o'clock, we have our urethra. 6 o'clock, we have our tailbone. Generally, there's a couple of different ways in which we can use the pelvic wand depending on what we're trying to achieve. If we're looking to do some self-release work to some of the more superficial muscles, or really just increase mobility in through the vaginal opening, then we would use the pelvic wand like this. So we have like what we call a dinosaur side or a snake side. So what we would do is we would enter the vaginal opening and we would find 6 o'clock and we would just push downward. Now, this should not be painful. We always talk about having something within like a 0 to 3 thresholds for stretching, pulling. We don't want anything that's like sharp shooting pain, discomfort. Typically, we hold this for about 30 to 90 seconds. You should feel as you release and then attempt again that those muscles start to release, they start to relax, they have less tension, maybe a bit less discomfort. What we then do is go over to 5 o'clock and we repeat the same thing. Holding for about 30 to 90 seconds, we typically instruct doing this 3 to 5 times. We would do the same thing over at 7 o'clock. And then what we have the option of doing as well is a sweeping motion from 5, 6, 7 o'clock. Okay, so again, we're here, we're entering the vaginal canal, we're pushing downward. And then again, we have the option of sweeping from 5, 6, and 7 o'clock. Now, the pelvic wand can also, based on its shape and this little knob at the end to really do more deeper pelvic floor release work, we can also switch it over to the snake side, which really allows you to kind of hook around to different deeper pelvic floor muscles. So oftentimes when folks are having some pain with deeper penetrative activities, maybe they're having deep pelvic pain, deep glute pain, back pain, oftentimes the obturator internus muscles that live more so in this area here, a little bit deeper, are affected. So what we can do is insert the pelvic wand like we did before, kind of that dinosaur side, and we can turn it gently to the snake side. And what that does is it gives us better access to actually find and perform some release work to some of those deeper muscles. Now, the great thing about this kind of handle and the way that we can maneuver the wand is that when you find a muscle trigger point and you just pull up on the wand a bit, it's going to push that nose side down right into that muscle belly. Folks will ask us what position works really well for performing internal release work, and that really depends on you and whatever feels most comfortable. Some patients will sit on a toilet, sit on a chair with their legs elevated using a step stool or a squatty potty, and they feel really able to access those pelvic floor muscles in that position. Some patients prefer standing with one leg up, maybe in the shower, for example. But we find that sitting up against the wall, for example, like in bed, and taking a pillow and placing one under each of the legs in more of like a butterfly position tends to be really comfortable for most patients. Of course, you can add more pillows depending on your comfort, but this tends to work very well. Again, you can use the dinosaur side and insert the pelvic wand and do more superficial stretching to the vaginal opening and do some sweeping. But also this position allows you to use your knees as a landmark for finding some of those deeper obturator internus muscles. So those deeper pelvic floor muscles that tend to get tight. So what you can do is switch it to that snake side, as we talked about. And if I think about taking this skinny side here, this long skinny side, and pointing it to my right kneecap, what happens is it turns the wand, and you can see how it points the end of the wand toward my left hip. So again, if we are inserted here and I take this side and I point it toward my right knee, we can see how the wand then turns and is able to access those deeper pelvic floor muscles. So again, we're here, I'm taking that wand, I'm pointing it to my kneecap, and I'm able to access the left deeper pelvic floor muscles. I can do the same thing for the right, where I turn that wand toward my left kneecap and just give it a little bit of a kind of a maneuver down, and I can feel that it's taut there. I would hold that muscle there in this position for, again, 30 to 90 seconds. Release, repeat, and that muscle should become softer, less tense, and feel a bit more comfortable. So this position works really well for most people.